The sound of the ICU at Sharp Chula Vista Medical Center carries all the way to the elevator.
So our ICU looks very different.
Danisha Jenkins heads the unit. They recently added noisy but crucial negative pressure systems to every patient room.
Prior to COVID, we only had 3 negative pressure rooms in our intensive care units.
The suction system keeps contagions from seeping into the hallway.
Now we've converted every single room up here to negative pressure.
The sound earned it a nickname, the spaceship. It now allows the hospital to safely host COVID patients in any of its ICU beds. San Diego County closely tracks that resource to reveal any extra stress from the pandemic. Governor Gavin Newsom relies on a data-driven process that controls limitations statewide, but a county system uses 13 metrics to drive local decisions that could further restrict activities in San Diego. A KPBS review of the county's process revealed local government and healthcare leaders don't always agree on how to count crucial resources, like ICU beds.
Pretty much with every patient interaction, there's some clinician putting something in the computer.
Back in Jenkins's office, her computer screen shows a system that logs the status of every bed.
They're blocked for one reason or another. They're dirty. Tells us if it has a patient going into it or going out of it.
But early in the pandemic, capacity got so tight they transferred patients to other Sharp hospitals. Nurses from UC San Diego even delivered baskets of snacks to keep up the Sharp team's energy.
The nursing community, especially during these times, is strong and powerful.
The county wants at least 20% of the region's ICU beds to be open, or it may consider new restrictions to limit community spread of the virus. The county tallies empty, clean beds as available, and that capacity hasn't dipped below 27%. But Jenkins says there's another, more realistic way to count beds.
And this is the number of staffed ICU beds that we have available.
Sharp's spaceship may have 40 unoccupied beds, but Jenkins says they may only have enough nurses for 30. That means what the county considers available may not always be ready to take patients right away.
If a hospital has 300 licensed beds, that doesn't mean at any given point they're staffed fully for 300 beds.
Dimitrios Alexio heads the region's hospital association. He says hospitals would have to add shifts and temporary workers to close the gap between open and staffed beds, but it is a familiar strategy.
So if we got to the point where we didn't have beds available, we would continue to work to find staff. It's what always happens.
The county wouldn't agree to an interview, but a spokeswoman says health officials don't focus on staffed beds because it will, quote, always look like the hospitals are almost out. She says the number, quote, doesn't accurately account for their ability to rapidly increase capacity and staff. At Sharp Chula Vista, the surge has subsided for now, but flu season is nearing, and reminders of the influx that could come again are all around. Pictures from children calling them heroes hang at the nurses' station. Brown grocery bags of staff protective gear fills their former conference room.
Everyone's equipment that keeps them safe. It's kind of crazy looking in there.
The county's metrics also track safety gear to make sure hospitals aren't running out. Yet some hospitals don't think they tally enough items.
You guys doing okay?
But for Sharp Chula Vista, the biggest mark from COVID is the ache left from losing one of their own. Jenkins and lead ICU nurse Eloisa Salinas embraced as they remembered Sharp's longtime facilities manager.
I had known this person for a long time, and I know the family for a long time, and now it was the end of life for this person, and it was heartbreaking.
51-year-old Raul Romo, a new grandfather who painted his beard pink for breast cancer awareness and played Santa at Christmas, died at the hospital in May after contracting COVID.
The numbers are people, right? And some of them were our people.
Romo helped build the spaceship. Taryn Mento, KPBS News.